Well, good morning, everyone, and thank you for your attendance at this beautiful location here in Banff. I'd really like to take this opportunity to thank David Lloyd, who initially pitched this idea that nutrition was of interest to the Alberta Institute of Agrologists. He's a very good salesman, and it didn't take him too long to persuade me that we should get engaged in writing a green paper for this conference. And it didn't take me very long to convince my colleagues that they should get involved either. So I'm Kathy Chan, and Noreen is waiting just in the wings for her part of the talk. In addition to Noreen and I've listed the contributors. The first four are from the Faculty of AILS and are in the Division of Human Nutrition: Rhonda Bell, Anna Farmer, Carla Prado, and Vera Mazurek. And Dr. Kim Rain is from the School of Public Health, but also has a background in nutrition. I'd just like to point out that we have the largest nutrition program in Canada at the University of Alberta, and our crop is about 50 dietitians every year in partnership with Alberta Health Services and many other partners, as well as about 80 other graduates who are experts in nutrition and food science and are very well positioned to take up jobs in many different sectors of our economy because of that broad-based background. Today, what Noreen and I want to do is talk to you about an ecological model of the food environment, which I think will resonate with this audience because of your holistic view of the environment and our place in it. Something we call the 4A framework, which is a way that those of us in nutrition think about factors that influence what people eat, implications in different populations, which is where Noreen is going to take over, and then at the end we'll suggest perhaps some action items and conclusions for the talk. So I'd like to begin by just talking about the ecological model of the food environment. We think that the food that comes out of the ground and out of the fields and out of the barns in this province all starts out to be healthy. And then Colonel Sanders or somebody else gets a hold of it, and it becomes not so healthy. And there's many, many factors that influence what happens to our food after it's been produced. So this is the ecological model. We didn't invent it, but it's been used many times to explain many different kinds of human behavior, such as smoking behavior, physical activity behavior, other health behaviors, including nutrition or dietary behaviors. So what this model is saying is that there's an ever-expanding universe around each individual in this room that is influencing our actions, independent of our own knowledge and our own beliefs. So here we are, down at the bottom, the individual, we have our knowledge and our attitudes. And our first level of complexity outside of that is our interpersonal relations, our families, our very close communities who influence what we do. Then there's our organizational context, so the place where we work, or our church, or other places that also have policies and provide services to us that can influence what we eat. And outside of that is our community, and outside of that is public policy. So the province, the federal government, and because we live in a globalized world, things that are going on in the European Union, things that are going on in China, are all affecting what we eat without us even thinking about it. So in the green paper, you may not be able to read this because the letters are a little small for this room, but in the green paper we describe a kind of specific example about how this framework might operate. And so at the bottom we have our individual. He's in front of a buffet, such as we might have for lunch today. And this guy is saying, well, what should I have? I have all of this choice. And so he looks at his friend, Joe, and Joe says, I'm having fries. And so you think, well, if Joe's having fries, maybe I should have fries too. And at the organizational level, this guy says, well, our workplace promotes healthy eating, which is a great thing, by providing vegetables in our buffet, but they still serve fries. And at the community level, this guy thinks the city I live in has more liquor stores than grocery stores, which is certainly true of Edmonton. And the nearest store to me only has bananas and snack foods, but it doesn't have any other fresh vegetables. And then the public policy piece of this says the price of food has increased this year because of diversion of some crops to biofuels production. And so things like that, that an ordinary individual might not think about, are still impacting what they might purchase at the grocery store and then consume in their homes. While we were writing our green paper, this new framework came out from the Institutes of Medicine in the United States. And we thought it was worthwhile showing to you because it, again, is thinking about food systems and what people eat in a very holistic and ecological sort of way. And again, it's a little small, but the basic premise of this is that everything is interconnected. And so what it's showing us is that schools and economics and health are interconnected with the weather and climate change and the price of rice in China. It's interconnected with transportation systems and other factors that influence what food we get delivered to our grocery stores and our restaurants, and it's influenced by the crops that we're producing. So the whole idea is that if we make a change in any piece of this wheel, it's going to have an impact on all of the other pieces. And so if we're developing policy and thinking about these kinds of things, we need to think about the whole wheel and not just our little piece of it if we really want to understand what's going to happen to the overall environment. So the example that the Institute of Medicine used was what happens if we tell Americans to eat more fish. Now, another example might be, how about eggs? I know my colleague Erin Lewis is going to be talking about eggs a little later. And it's interesting that in the United States, they've recently decided that cholesterol is not from the diet is not such a bad thing after all. And so it's possible that that could influence egg consumption. So that might have an impact down the line on how many chickens we need to have and how many barns and how much waste we need to dispose of from those chickens and so on and so forth. So that little tiny decision by experts on nutrition in the United States could have a very widespread ripple effect on the economy related to chickens and many other things, both in the United States and elsewhere. So that's when people who think about nutrition a lot think about the food environment. That's the way we're thinking about it, as this interconnected ecological framework or model. And the important thing that we want to get across to you is that individual food choices are complex and not just based on an individual's own knowledge and an individual's own attitudes. It's really influenced by the whole ecology that they reside in. Another framework that we at the U of A like to use for our research and the way that we think about the food environment, we call the 4A framework. In the 4A framework, the 4 A's are food availability, food accessibility, food acceptability, and food or nutritional adequacy. And I'll just explain each of those a little bit. So if we start at the top with food acceptability, things that affect food acceptability include things like culture. So for example, certain religious beliefs say that you shouldn't eat pork, or you shouldn't eat this, or you shouldn't eat that. So that affects what might be acceptable for you to eat. Hedonic properties refer to the smell of food, the taste of food, how good it looks on your plate. And then there's things like family preferences as well. So little Joey doesn't eat peas, so the whole rest of the family ends up not eating peas. On the bottom, we have food accessibility, and this refers to geographic accessibility, so this idea of how close the grocery stores are to your home. If you live in rural Alberta, there might only be one grocery store, and it might be 20 kilometers away, so that might impact the way that you buy your groceries. It also refers to financial accessibility, or what we might call affordability, as a 5th A, and obviously that's a very important driver of what people eat. If we want to look at food availability, what we're talking about is what kinds of food are grown locally and what are imported regularly. What are the things that we can count on being on our grocery shelves day in and day out? And then we have nutritional adequacy, which is obviously very important. We have Health Canada producing Eating Well with Canada's Food Guide to provide us with advice on this matter. We have other guidelines from places like Heart and Stroke Foundation, Canadian Diabetes Association to help people with chronic diseases. Those things don't mean anything if individuals don't have some basic knowledge of them and of how to translate those recommendations into dietary patterns that are healthful for them. So now I'm going to pass the podium over to my colleague Noreen, who's going to talk about food environment through the food security lens, and she'll tell you what she means by food security and give you some examples of research in that area.
I'm going to take over from Dr. Chan and build on her 4A framework, talking about a research area that I have some competency in, which is food security and food insecurity. I have a Health Scholar Award to look at food security in the Aboriginal population, so I'll be talking about that group. So there's confusion often when we hear the word food security. People often think, is the food supply secure? So I'm going to talk about it in relationship to Health Canada and how it's measured on the Canadian Community Health Survey nationally. So there's many different definitions of food security. I'm going to go through this list here as one way of conceptualizing it. If you're food secure, you can afford to purchase and are able to access nutritious and safe food that is enjoyable to eat. You can access your food with dignity. So this is important because in Canada we have a system, for example, of municipal food banks that can provide emergency food relief for people who are food insecure, but that's not a way for people to get food with dignity. Relying on charity does not allow people to have dignity. That individuals can access and grow food in environmentally and socially just ways. That people can feel confident about having enough food. So it's not just that people have enough food to eat, but they're not anxious about having insufficient food. They're confident that they can feed themselves and their family. And that people can share and celebrate food. So this kind of packages it up very nicely. The Food and Agriculture Organization has their specific definition of food security, which I'll read out. It is said to exist when all people, at all times, have physical, social, and economic access to sufficient, safe, and nutritious food, which meets their dietary needs and food preferences for an active and healthy life. So that's food security. Unfortunately, in a country, even one as privileged and as wealthy as Canada, we have individuals and households and communities that are food insecure. So it's a little more than the inverse of the definition that I just provided for you. If individuals are food insecure or if families are food insecure, they can't access foods that they consider to be healthy for themselves or their family or enjoy those foods. They may feel stressed about having enough food or about where the next meal will come from. So they may be anxious even if they have enough to eat. There may be a mental health toll to having concerns about having adequate foods. They may be worried about the safety of their food and about what is in it. And there may not be sufficient and safe food for future generations. They may be concerned about that. So in Canada, the federal government measures at the national level on the Canadian Community Health Survey food insecurity at the household level. And this is because families share resources. So we actually don't have measures of individual food insecurity or community food insecurity, but we do know something about household food insecurity, which is defined by Health Canada as inadequate or insecure access to food because of financial constraints. So it's tied to the inability to purchase food, and it's a significant social and health problem. So this is some data from the proof study out of the University of Toronto by Valerie Tarasik, where they have looked at the Canadian Community Household Survey data and provided us with prevalence estimates of household food insecurity. So recall that this is a household's financial inability to purchase food. In Canada, the latest estimates show that 1.7 million households, representing about 12.3% of households across this nation, are financially food insecure, which is startling. When you think about food insecurity being something that maybe is more common in less financially developed countries, it's here in Canada. People are hungry. This means that 4 million individuals, including 1.2 million children, live in households with uncertain access to food because of lack of money. So what happens when people are food insecure? As I said, sometimes it just manifests itself as anxiety. In other cases, if the food insecurity is more severe, it means that people change the way they eat, they budget, they may eat less, or in cases where the situation is dire, such as in Nunavut, people may go hungry and not eat for an entire day. We know that in households that are food insecure, often dietary diversity or variety decreases. And this is more and more nutritionists are moving towards dietary diversity as being a measure of whether or not people are eating healthy foods. If you restrict the number of foods that you consume, it's very likely that your nutritional well-being is being diminished. People may consume more energy-dense foods. These are foods high in fat and sugar. They're often of poor nutritional quality, but it makes sense. It makes sense because they're less expensive calorie for calorie than alternatives. So people often say to me, well, you know, it's not a lot of money to buy a bag of carrots. But if you look at the caloric value of those carrots and you've got a number of hungry children to feed, it makes more sense to buy processed food, which are cheap calories. They fill you up. So people may change their diet in ways that actually compromise their health. So we can map out household food insecurity in Canada, and again, this is from Dr. Valerie Tarasik and her team's work at the University of Toronto with their proof study. You can see that the most dire food insecurity in the country is in Canada's north, in places like Nunavut and the Northwest Territories, where almost half of households are food insecure, and also in the Maritimes. Even in a wealthy province like Alberta, almost, I need to take off my glasses, almost 12% of households are food insecure. Because of the distribution of our population in Canada, although Alberta and Ontario have low rates of food insecurity, they represent the most people who are food insecure. So we could be doing better in this province, considering the wealth that we do have and the number of people who have concerns over their ability to access healthy foods. So it's often a surprise to people when we look at the primary source of income in households that are food insecure. These are the working poor. It's not people relying on charitable handouts. It's not people on welfare. It's not people on unemployment insurance, although those people may have the need for those sources of income. It's actually people who are working. They may be working more than one job. They may be in low-paying jobs. They may be working on minimum wage. So the people in this country who don't have access to food are the working poor. They are people who are trying to make ends meet and are unable to do so. Fewer people in Canada rely on social assistance for income, but of those who do, the majority are food insecure, 70% of it. Meaning that these programs are unable to provide people with sufficient resources to access food.